Hi, I'm Tyson Franklin, and welcome to this week's episode of the Podiatry Legends podcast, a podcast designed to help you feel, see, and think differently about the podiatry profession. I want to ask you a question. Say, for example, you walked into an optometry clinic for the first time, hadn't been there before. You've had a problem with your eye, say, the last year or so, but the last couple of months it's getting worse. You finally decided I need to do something about it. You walk up to the reception counter, and the receptionist says there's two optometrists working today. One door says Jane White, optometrist. The other door says Dr. Mary Brown, optometrist. Same clinic, same profession, same training. In fact, they probably went to the same university. But which door do you instinctively feel more comfortable walking into? Or if you had to choose, which one would you choose? Now, I don't want you to overthink this. Just notice your first reaction, because that reaction says a lot about how human beings make decisions. And it ties directly into something that happened in the last couple of months. There was a Facebook thread in this particular podiatry group in Australia. And the topic was, should podiatrists use the title doctor? Now, I'd like to point out this was an Australian group, and they were talking about Australian podiatrists. And I know in the US, it's not an issue at all, and I'm not sure where it sits with the rest of the world. So just talking about Australian podiatrists here in this Australian podiatry group. Anyway, what started as a simple question turned into something far more interesting. Some people said it was misleading. Others said it was unnecessary, didn't need to be used. But a few said, oh, it was cringe. And then it escalated quite quickly. Words like you're a peanut for using it, you're a wanker was thrown around if you use the doctor title, all over two letters, D and an R. Now, here's the part that made me stop and think. In Australia, podiatrists are legally allowed to use the title doctor as long as they clearly identify themselves as podiatrists. So if it's legal, why does it trigger such a strong emotional reaction inside the profession? That is what we're going to be diving into today. So I'd like to point out that this is not a new debate. If you've been in podiatry for a while, as I have, you probably see this pop up every year. Someone will mention it in a podiatry group. It seems to be the same podiatry group, and I'm sort of wonder if someone deliberately does it just to create a bit of commotion in there. But it's always the same arguments. It's the same opinions. It creates the same tension. But what made this thread different, it was just the tone. It wasn't just disagreement, it was quite emotional. And at times, it got quite personal. And whenever a professional discussion becomes emotional, it usually means there's something deeper going on. This isn't just about the title. It's about people's identity. It's also about status, perception, and how we see ourselves as health professionals. But first, let's look at the legal reality and let's just get the facts straight right from the beginning. In Australia, podiatrists can use the title doctor provided they clearly identify themselves as podiatrists. Do not mislead patients into thinking that they are a medical practitioner. So, from a regulatory point of view, it is 100% allowed. Perfectly legal to do it. And this falls under the guidelines from the Australian Health Practitioner Regulation Agency, one of my favourite groups, AHPRA, which governs how registered health professionals present themselves to the public. So the debate isn't about whether it's legal or not, it's about whether it's appropriate to use. And more importantly, why do people feel strongly about this? So after reading the comments in this Facebook thread, three main arguments really stood out. The first one was you didn't earn it. And this is probably the most common argument. The belief that the title doctor should only be used by someone who has a PhD or a medical degree. And I completely understand where this comes from. A PhD, it's a serious commitment. But a PhD is fundamentally it's a training program in research. It teaches someone to formulate research questions, design studies, analyze data, critically evaluate evidence, but they also contribute new knowledge to the field or to the podiatry field, which is very important. In podiatry or any other health profession, that usually means becoming an expert in a very narrow slice of knowledge. For example, they might be talking about or might be doing research on plantar pressure or some area of biomechanics. It could be about wounds or diabetic care. They might be talking about orthotics and different materials that are being used, or even running and gait analysis. That depth is valuable for science and evidence-based practice, but it does not automatically translate into day-to-day clinical skill. So, what makes a great clinician then? Clinical excellence is built from a different set of abilities. Pattern recognition from thousands of patient encounters. The more patients you see, the more experience you get. Diagnostic reasoning and decision-making under uncertainty, because sometimes we're not sure, but we have to make a decision. Communication and patient trust. Practical treatment decisions. Hands-on procedural skills and time management in busy clinics. That is really, really important. Those skills usually develop through clinical experience, mentorship, there may be some coaching involved, and repetition. It's not research training. And podiatrists who have seen 10,000 patients often have clinical instincts that a full-time academic researcher may actually never develop. But these two worlds do overlap. Where PhDs really shine clinically is in evidence interpretation. So a clinician with research training may be better at identifying weak studies, avoiding pseudosciences, applying evidence correctly, and designing better treatment protocols. So a PhD can make someone a more evidence-informed clinician, but it doesn't automatically make them a better hands-on practitioner. And to give you a simple analogy, if you just think of Formula One, for example, you might have the engineer designing the car, and they may have a PhD in mechanical engineering. The driver winning the race may not, but both are experts at what they do, just in different domains. So in podiatry, you will find there's outstanding clinicians who do not have a PhD. There'll be researchers with PhDs who rarely see patients or are in a clinical situation, but there's a small number who excel at both research and clinical practice. They do exist. This third group is rare because the skill sets require very different time commitments. They've published research, they've taught evidence-based practice, and they are also seeing patients on a regular basis. So I must say those individuals are gold for any profession, not just podiatry, because they bridge the gap between science and clinical reality. But as I said, they are rare because each path just demands so much time. The key point I'm trying to make here is a PhD signals research expertise, not clinical superiority. And most patients ultimately care about one thing. Can you diagnose my problem and help me get walking again without pain? Or whatever problem they've got, can you help me? That's why clinical reputation is usually built in the treatment room, not at a university and not in a laboratory. But I do know in the academic world, a lot of value is placed on the word doctorate, and titles they're like the holy grail. And for many, using the title doctor, it represents that long journey that they have actually undertaken. Now, I was recently at my daughter's pharmacy graduation and saw firsthand all the people that had their PhDs, all the different doctorates, all the people wearing the different coloured hats and the different robes. And I tell you, they were almost bowing and saluting each other. So in the academic world, that is super important. But in the clinical world, not so much. But here's the thing that gets interesting. Dentists use the title doctor, chiropractors use the title doctor, and patients don't seem to be confused by it. So clearly, in the real world, the title doctor has sort of evolved far beyond the PhD and medical world. It's no longer just an academic label. It's also a professional signal. And this leads on to the second argument about it confusing patients, and using the doctor title could mislead patients. Now, it sounds reasonable, but let's think about it logically. If someone books into a podiatry clinic with a foot problem, what are they expecting? I assume they're expecting to see a podiatrist. They're not expecting to see a brain surgeon. So patients are often far more intuitive than I think the health profession gives them credit for. They look at context. They look at the environment. They look at the service being offered and who is best to provide treatment for that service. I would argue with anyone about podiatrists knowing more about the foot than any other health profession. I don't think anybody knows the foot as good as podiatrists. A few months back, I actually had to see a specialist sports physician for my right ankle. Now, I knew exactly what the injury was. I knew exactly what diagnostic treatment I needed. I had to get an MRI. I knew what treatment was required, but I couldn't do anything without that specialist referral. After my visits concluded, I walked away thinking, yep, he was a specialist. He had all the letters. He was using the title doctor. But I knew when it came to the foot, I actually knew more than him. Anyway, this leads on to the third argument that was purely emotional. Or should I say it created emotional responses. Comments like, ooh, it's cringe. It's embarrassing. But then the personal attack started. Referring to other podiatrists who use the title, let me point out again, a legal title that they're entitled to use, as peanuts and wankers. Once a discussion goes there, it's no longer about logic. It's about emotion. These people are social policing rather than debating professionally. And it's important to note that emotion usually comes from something much deeper. So let's unpack why this debate triggers people. The first thing to unpack is professional hierarchy. Healthcare has always had layers. And I remember when I was at university, an orthopedic surgeon coming in to talk to us, and he told us, with no apology, where he felt we sat on the totem pole of health professionals. And I've never forgot that conversation. And from that point on, I was going to always defy that. But in healthcare, like I said, there's different layers, there's different roles, there are different titles, there's different levels of perceived status. When someone uses a title that others don't, it can feel like they're trying to actually elevate themselves, even if that was not their intention. Healthcare professions are status-sensitive ecosystems. Titles are almost like symbolic currency. When someone uses doctor, some colleagues interpret it as they're trying to elevate their status. If they personally choose not to use it, they may feel subconsciously challenged. Not because the person who uses it is wrong, but because it shifts that perceived hierarchy. And when identity feels threatened, people will get into defensive mode, and sometimes very loudly. The next thing to unpack is what I call scarcity thinking. If someone believes respect is limited, then your gain will actually feel like their loss. It's the same psychology behind resentment towards visible success. Some people that have really flash cars or really big homes, or they have really large clinics with all the bells and whistles, everything that goes with it. If they look at its status as like a fixed pie, then anyone taking a bigger slice feels offensive to them because they think they're missing out. So abundant thinkers will always say, great, this is lifting the profession. Scarcity thinkers will say, you're trying to look better than me and you're trying to take something, and when you take it, it means I'm going to do without. But in reality, authority isn't a limited resource. There's plenty to go around. And it's also important to point out too that some podiatrists are very proud of the title podiatrist, and they should be. It is a highly skilled profession. And where it has come over the last 30-something years since I've been involved in it, it is amazing where it is now and where I think it's going. And the caliber of podiatrists coming through are exceptional. So when someone chooses to use the title doctor, it can, for some people, they will look at it that it's an unnecessary upgrade because they're super proud about being podiatrists and they can't understand why anyone else wouldn't just want to be a podiatrist and not worry about using the title. And sometimes the reaction isn't about the title at all. It's about how someone feels about their own positioning. So let's take marketing as an example. If someone is uncomfortable promoting themselves, if they see others doing it, it can create this, it creates irritation. Not because it's wrong, but because it's confronting to them. Now, I recall a local Cairns podiatrist, who shall remain nameless, who would always complain about my marketing. Anything I did would always be going to the registration board, say I was doing something wrong. And once again, the registration board would say, no, I'm not. But he always felt threatened by what I was doing, probably because what I was doing, he was not prepared to do that himself. Now, here's the key part. Being rude is not the same as having a different opinion. You can debate the ethics of title usage professionally. You can disagree. You can even campaign against it. But rudeness usually signals emotional activation, not an intelligent disagreement. Yeah, is it jealousy? Sometimes yes, sometimes no. Often it's insecurity dressed up as a principle. And as I said before about expensive cars, when someone drives a high-end car, critics rarely debate the engine specs. They attack the character. They'll say, oh, look at that person driving that car. They must be. They don't talk about, oh, look at that car. Its fuel consumption is such and such, and its engine specs aren't as good as this other car that's much cheaper. That tells you the reaction is emotional, not technical. And the deeper question for everyone is this: does using the title align with your values, your brand, and how you explain your qualifications? If the answer is yes, then you're compliant with the regulations, then the noise is just noise. When a profession argues publicly about this whole internal hierarchy, it signals insecurity to the outside world. When a profession stands unified and confident, the public perception actually arises as well. So the title debate is small. The professionalism around the debate is not. Now, this other thing I want to talk about is sort of like the missing piece: PhD versus clinical expertise. There's something important missing from a lot of these conversations. When people argue that only someone with a PhD should use the title doctor, the assumption is academic expertise equals clinical superiority. But that's not how it works. Like I said before, a PhD is training in research. It teaches you to ask questions, analyze data, challenge existing evidence, which is incredibly valuable. But clinical excellence is different. It comes from seeing patients, making decisions, learning from real cases. I've met podiatrists with PhDs that rarely see patients. And I've met clinicians who have treated tens of thousands of patients and can diagnose problems really quick. Both are experts at what they do, like I mentioned before, just in different ways. So a PhD proves you can generate knowledge, but clinical experience proves that you can actually apply that knowledge. Now, there's this thing called the authority illusion, and this is where things get really, really interesting. Patients don't always judge expertise based on evidence. They judge it based on signals. Things like a title, using the title doctor. Universities, the professor, associate professor. Titles are important. Wearing a white coat, wearing scrubs. I've noticed a lot more podiatrists wear scrubs to work. Modern clinics, busy waiting rooms, online reviews, media exposure. These are all signals. Now, they don't guarantee skill, but they influence perception, and perception influences behavior. So patients will often make quick decisions because they're creating these mental shortcuts between these signals. You see someone wearing a white coat, they've got the title, they've got a reception area that is really busy in a really nice, big, fancy clinic, and within seconds, they're going to think that that is the place that they need to go to. Now, there are three types of authority. When you step back, authority in healthcare comes from three different places. One is academic authority, like degrees, research, and publications. Then you got your clinical authority, which is experience, repetition, and more importantly, patient outcomes. And then you have perceived authority, signals, presentation, visibility. The best clinicians build all three, but most arguments about the doctor title focus just on one, the perceived authority. So let's go back to that two-door story that I mentioned in the introduction. You got your two doors. One door says Jane White, optometrist, and the other one says Dr. Mary Brown, optometrist. Now, your brain makes an instant judgment. That is human nature. But here's the twist. What if the optometrist behind the first door has treated 20,000 patients and the one behind the second door that uses the doctor title has just graduated? Who would you rather see if you knew that information? Because once the consultation starts, that title just disappears. Skill becomes obvious. Patients might choose initially based on the signal, which is like the doctor title, but they will stay based on the trust and the results. For me, the real issue isn't the title. The most concerning part of that Facebook thread was the disagreement. It's how we treat each other as professionals. Disagreement is fine, and I think we should disagree. We shouldn't agree on everything all the time. Healthy debate is really good. But publicly mocking each other, calling them names, ridiculing colleagues just because they choose to actually use the doctor title, that reflects poorly on our profession. If a student was reading that thread, what are they learning about our profession? Now, I did actually make a comment in this Facebook group, and I was telling students to pay close attention to the comments and who was saying what. And I said, make a mental note of this. Actually write the names down and pay attention to what is being said and who is saying it. Because one day when you graduate, you're going to be looking for work, and you need to choose wisely. Look at those comments and use them to help you make a decision where you're going to work. So, just in closing, should podiatrists use the doctor title? Ultimately, it's a personal decision and a professional decision. What matters more is this: are you honest with your patients? Are you clear about your qualifications? Are you competent in delivering excellent care? Because patients don't come to see you because of those two letters. They come because they trust you. They've heard about your reputation. Authority might get them through the door, but clinical skill is what's going to keep them coming back. So if this episode has made you think about how you position yourself, how you communicate with your patients, and how you actually run your clinic, that is a good thing. Because building a great podiatry business isn't just about clinical skill. It is about clarity. It's about having confidence with what you're doing, and it is having some direction on where you actually want to take your career. And if you ever want to have a conversation about any of this, or about your clinic, or where you're headed, please just reach out to me. There's never any pressure. We normally just have a conversation. And the last thing I just want to say is just remember, your reputation is never going to be built on titles. It's built in that treatment room. It's built on the care that you give and the results that you get with your patients. And from there, the word of mouth will spread. So that's it for me this week. I hope you got something from that. I would love your feedback on this particular title. Unless you're going to call me a peanut or a wanker, I'm not interested. You can keep those comments to yourself. But anyway, that's it for me this week. I want you to look after yourself, look after your family, and I will talk to you again next week. Bye for now.